Hello everyone, my name is Elena Valentine and I chose Switzerland's healthcare system to compare to our healthcare system. I chose Switzerland because they are well known to have one of the best healthcare systems in the world. In my paper, I began by discussing the history and development of our system, specifically how healthcare evolved from barbers doubling as surgeons to the establishment of the American Medical Association, or the AMA, the introduction of the Patient Bill of Rights, and ending with the 2010 Affordable Care Act. Switzerland was a challenge to find relevant information on. However, their current healthcare system has been implemented since 1996 and is very similar to the managed competition plan proposed by the Clintons in the early 1990s. In 2012, Switzerland introduced DRGs, or diagnostic-related groups, as a method for classifying illnesses to determine a rate of reimbursement. Moving on, there are many different roles that play parts in the healthcare industry here in the United States. There are three parties involved in providing healthcare: the provider, the patient, the fiscal intermediary, like the government or insurance companies. Health insurance facilitates access to healthcare services and helps protect the consumer against the high cost of catastrophic illness. There are different types of health insurance, such as group insurance, individual private health insurance, self-funded or self-insured, and managed care plans. At the time of service, consumers pay either a copayment, coinsurance, or deductible. It is important to note that Medicare and Medicaid are the two largest government-sponsored health insurance programs in the United States. In Switzerland, it is illegal to not have health insurance, so logically, an insurance company cannot legally reject a consumer based on their health status, age, or gender. The Swiss health insurance industry is private. However, the government sets regulations and price thresholds for the industry. Consumers are able to adjust their premium by selecting a larger or smaller annual deductible, or by joining something similar to what we know as an HMO plan. As we all know, the United States healthcare industry feels the impact of a variety of different laws. Some of those laws impacting our healthcare system are the Hill-Burton Act of 1946, the EMTALA, Child's Health Insurance Program, also known as CHIP, Benefits Improvement and Protection Act, and of course, we can't forget about HIPAA national standards. The United States is quite conservative in regards to ethical dilemmas such as euthanasia and physician-assisted suicide. As a matter of fact, only 4 states that currently allow physician-assisted suicide. Those states are California, Oregon, Vermont, and Washington. On the other end of that spectrum is the liberal Switzerland, that allows any person to assist in the suicide of another as long as the assistance is not motivated by selfishness. Switzerland is very concerned, however, with the privacy of patients' medical records. In fact, they have developed the Data Protection Act, also known as DPA, to protect the privacy and fundamental rights of persons when their data is processed. Moving forward to the U.S. healthcare expenditures, in 2010, $2.6 trillion went towards healthcare. Yes, that was $2.6 trillion, equaling out to 17.6% of the country's gross domestic product. In comparison, the Swiss healthcare expenditures equal out to 11.4% of the country's gross domestic product, and ties for the third most expensive healthcare industry with France, whereas the United States is obviously the most expensive. The United States as a whole has moved to the use of EHR systems, or electronic health records, to better maintain patients' medical history. The benefits of this system include providing an opportunity for administrators to assess the workload of each department, an opportunity to analyze and review patient outcomes, and of course, it takes 30% less time for the documentation process, as opposed to the traditional handwritten notes. However, the downside is the high cost of implementation. Some of the innovative uses of technology in patient care include the Mellifind optical scanner, electronic aspirin, needle-free diabetes biosensor patch, robotic checkups, the Sapien heart valve, Acuson P10, and the Piccolo Express chemistry analyzer. The use of technology in the U.S. for patient care is aimed at increasing the quality of care received by the patient. In Switzerland, an e-health strategy was launched in 2007 with a full implementation goal of 2015. One of the goals of this e-health strategy was to phase medical records to smart card-based electronic medical records. One of the uses of technology for patient care is AlarmTouch, which is a personal safety and location system for patients and has a geofencing system that initiates a call to a caregiver when a patient strays too far from a specified area. The AlarmTouch system provides the caregiver with the patient's location in order to enable immediate access to that patient. Lastly, the quality of care in the United States is not as good as it should be, considering that we have the most expensive system in the world. Though Switzerland is expensive as well, they are known worldwide to have one of the best healthcare systems in the world. I personally think that the United States has the potential to be as good as the Swiss healthcare system. However, for that to happen, there needs to be some things changed. First of all, there needs to be compliance on the part of consumers to purchase health insurance. The coordination of care needs to be improved, and healthcare reform needs to take place in order to put caps on the amount plaintiffs can receive from a lawsuit, in order to lessen the cost of malpractice insurance so that healthcare can be more accessible to everyone. Thank you guys for watching, and good luck!